I encourage you to use the chat box, and that's at the bottom of your screen. It'll say chat. You just click that, it'll open up there. And then during the call, we just ask that you stay muted so that you don't interrupt the speakers. So before I introduce our speaker, I wanted to share a little bit about why we started this speaker series. So Christ House initiated the Ambassador Program last year, with the goal being to connect individuals who are committed to volunteering, fundraising, and spreading awareness about Christ House's mission. And so at the end of 2021, we asked our ambassadors for feedback, and one person shared that he wanted to do a little bit more about learning about homelessness and advocating for our work. And so with that in mind, we started our speaker series. So this is our second event of the year. And we're really glad to be able to host these as a way for our community to learn more about homelessness and some solutions around it. So for this event, our ambassadors put together a list of compelling questions for our speaker, and we're really grateful for their support and for you all for being here. So now I'm excited for you all to learn more about not just our Kairos program, but our Kairos program director, Kelly Reed. Kelly is the director of the Kairos program, which is Christ House's long-term addictions recovery community for men suffering from chronic illness. Kelly began her social work career as a case manager, year-long volunteer in 2014. At Christ House, Kelly learned about the complex systems on which patients rely, and she gained valuable experience assisting patients in navigating those systems. Kelly uses the training she received at Christ House, as well as her experience providing psychotherapy and case management services across a variety of settings to help the Kairos members maintain healthy and sober lives. We're so glad to have Kelly in our community, and I'm excited to now turn it over to you, Kelly.
Thank you, Kira. I really appreciate the introduction. I'm excited and honored to be with you all today virtually. I want to echo Kira's gratitude that we thank you so much for being a part today and for your interest in this, this topic. So our time is going to fly by, so I want to jump right into to what we're supposed to be talking about today. So I want to start by telling you a snippet about my story, my time as a year-long volunteer, what I do now at Christ House, and tell you about the Kairos program, which is really the main thing that I want to discuss. So Kira already told you that I was a year-long volunteer in 2014, ended in 2015. I was in the case management office. Before I became a year-long volunteer, I had an interesting route to becoming a YLV, as they call it. Most individuals come straight from undergrad and they use the year-long volunteer program as a chance to get more experience, maybe to take a little bit of a break from school, but also do something meaningful before going into their desired career field, prep for med school. But I was a little different because I came from the professional world. I actually had several years of experience as a public relations and outreach professional at another nonprofit in DC. And it was actually at that nonprofit that I became aware of the different socioeconomic challenges that people in general face, not just people who are homeless, but just people in general. It wasn't something that I had actually been aware of previously. I'm fortunate enough that my life was pretty smooth sailing as a child, and my mother and my father did a decent job of sheltering me from the realities of the world. But when I got to this job, it was like I was encountering things left and right. As an example, I worked with students who were trying to go from high school to college, and I was telling them about a scholarship program, and a lot of them were like, oh, that's cool, but we're sleeping in our car. We don't have food to eat. Our lights were just cut off. And I was just like, wow, people deal with these types of things. And I felt what I can only describe as a tugging to kind of help these individuals overcome the challenges. So that started a process of me researching different careers that I could enter into to do my part in helping people deal with the socioeconomic challenges that they were facing. And to make a long story short, stumbled on Christ House, the year-long volunteer program, and I was accepted. While I was there, I learned so much. Rick and Bill were the case managers in the office at that time, and they're still here at Christ House. They do amazing work. And they just taught me so much. They spent a great deal of time teaching me about the different systems, Medicaid, Medicare, disability, SSI, SSDI. I was able to support some individuals with getting income for the first time since they had been homeless by helping them, apply for disability. I learned how to apply for non-driver IDs, and I learned how to get, patients with a higher level of care or higher level of need into nursing homes. So I just learned so much about social work and just case management in general and serving the population here at Christ House. But I also learned some soft skills that I'm just so grateful to have learned during that time. I mean, the advocacy that the case managers do here at Christ House, I was able to kind of take that in and absorb it and use that even to this day. The problem solving, the unconditional positive regard that they showed towards patients that were, maybe a little bit on the challenging side. So all of that was just a life-changing education and experience for me. And don't tell my graduate alma mater this, but I feel like I learned more here at Christ House in that 1 year than I did in my entire graduate career for social work. So just truly grateful for that experience. And I would say that it was life-changing, life-altering, because quite possibly I wouldn't be here before you talking about the Kairos program had I not had that experience and caught the bug to do my part helping others. So fast forward, graduate school, I had a couple jobs being a therapist at various places. I've worked mostly with children and families dealing with some challenges, particularly suicidality. And, life has brought me back to Christ House, and now I serve in more of an administrative role over the Kairos program, but I also still do case management with the Kairos gentlemen. And I also serve as somewhat of a community builder within the Kairos program to kind of develop that sense of brotherhood with everyone. So that's enough about me, because I want to get to the real meat of our discussion. I want to tell you about the Kairos program. So when I was a year-long volunteer, I think I maybe interfaced with a couple of Kairos men here and there. And I really just thought, oh, those are men who used to be patients at Christ House who now are living in an apartment that Christ House is funding. I didn't know the ins and outs of it. And I'm glad that I know now, and I'm glad that I can communicate this out to you all so you can really understand how truly magnificent this program is. I mean, it's a gem. So I struggled to come up with kind of like a one-liner about Kairos. And so what I came up with is that the Kairos program is a spiritually grounded, long-term recovery program for formerly homeless men experiencing chronic illness who desire to live in a supportive community. That's a lot, right? I feel like I just said a mouthful, but all of that that I mentioned is so important when you're looking to understand who we are as a program. So the goal of the program is to prevent relapse with our program participants, and also prevent the recurrence of homelessness, which is a lofty goal, but we have several different interventions that we use, and we've been very successful in reaching that goal. So we accomplished it by providing affordable housing at Kairos House, quality healthcare, a robust menu of supportive services, and I feel like most importantly, a loving community. So Kairos started in 1992, and our very first program member, Mr. Jones, is actually still a member of the program today, and he's a very active part of the Kairos community, as well as Christ House. He serves on the board of directors. And so it started out as a way for former patients of Christ House to kind of stay connected to Christ House, and also work on their substance abuse challenges. It was sort of like a scattered site program, if you know what that means. So instead of it all being in one building, the Kairos members during that time had apartments in various locations that were near Christ House. And they would come back, have meetings, serve as volunteers in various roles here at Christ House, and just stay connected. So the program had some success, obviously, and the powers that be had discussions and decided that, you know, we should put everybody in one building and really build on this sense of community and this togetherness, as it seems to be working pretty well. So Kairos House was purchased in the late 90s and renovated. I actually just learned this. There's going to be a pretty cool feature about Kairos House because we've been in existence for 30 years now. So there's going to be a feature in the fall newsletter. Just want to put a plug in about that. And it talks a little bit about how the building was renovated, and you can see some cool before and after pictures. But apparently the building that is now Kairos House was sitting abandoned for years before Christ House came and renovated it and decided to dedicate it for, you know, the Kairos program. So the building, I'll just tell you real quick, we have 37 units. 23 of the units are single apartments, and the remaining of the units are kind of like shared apartments. So you come in and then there are 3 bedrooms off of the common area. The building has laundry rooms, a gym, meeting rooms, offices, an enclosed backyard. And we're very proud of it as a community. So if anybody ever wants to have a tour, you know, we can definitely arrange that. But the eligibility to be a part of the Kairos program is that 9 times out of 10, most of our program participants are former Christ House patients. So that's the first thing. And we have made exceptions for those who are needing the program and who are appropriate. And then you have to have some type of chronic illness that you're trying to manage. And then we want you, of course, to have a commitment to recovery, because it is a sober community about substance abuse recovery. So the program's staffed by multiple people, but I'm going to tell you about the full-time folks, myself. Then we have an addictions counselor, clinical support coordinator who kind of works in tandem with the other medical providers to support the Kairos members in caring for their illnesses. And then we have a housing coordinator as well, which is kind of like, he does a lot as far as keeping the building running. So said a lot. Want to pause and kind of shift gears a little bit to tell you about the 5 components that kind of make up the Kairos program. So, you know, they live there, but what do they do on a day-to-day basis? What does the program actually entail? So we have 5 key components. We have spirituality, healthcare, service, community, and then of course, recovery. So I'm gonna go into each of those a little bit now. So for the spirituality part, I think that's what makes us different from other programs. I've done a lot of research on other permanent supportive housing programs, which is what Kairos House is kind of categorized as. And none of the other programs have the spiritual element in the way that we do. I think that that's very important because we're also based on Alcoholics Anonymous and Narcotics Anonymous principles. And if you're familiar with the 12 steps, It talks a lot about surrendering to your higher power, asking your higher power for, help in righting your wrongs or, examining your character defects. So that's something that we decided to incorporate in the essence of the Kairos program. So how we do that is we have multiple Bible studies that the men can participate in on a weekly basis. We have prayers, Sunday worship service. We have table fellowship as well, which has been on hold since the pandemic, but that's a big part of our spiritual component here. We have other special services for religious holidays that the men can participate in. And so we really try to, develop that person's sense of spirituality and their connection to their higher power as well. Pastor Allen here, who is one of the founders, he also has meetings on a weekly basis with all of the men for spiritual counseling as well. So that's something that it's very important and makes us unique. So then healthcare, that's the next component, the second one. Each Kairos member is connected to a primary care provider at Christ House. And they follow them and help them to manage all of their conditions. And like I said earlier, we also have a clinical support coordinator, and she's kind of like the linkage. So she connects the PCP about what's going on with the Kairos member health-wise. She also helps to, facilitate referrals to specialists for their different conditions. And that really, that safety net really helps to make sure that all of our men are taken care of health-wise. For added context, I know I told you that part of the criteria, the eligibility criteria, is to have a chronic illness. Well, 95% of our current Kairos program members have 3 or more chronic illnesses that they're trying to manage. So that care and that communication between providers is really critical to maintaining their health. So then the third component that I mentioned is service. Going back to the 12 steps and the principles of AA and NA, it also talks about, once you get yourself together, once you have a revelation and you're on the road to recovery as far as your substance abuse is concerned, go out and help somebody, share the message, let them know that you were in the same position and show them how you've changed. And so we do that by asking the members to participate in different volunteer roles throughout Christ House. And that can look like escorting a patient to an appointment or helping to set up for AA, NA meetings that they lead at Christ House, or setting up for church, or leading bingo. One of our long-term, Kairos members leads bingo on a weekly basis for the patients as a way to provide them with a fun activity, but also, show them like, hey, this is what you can be too. So that's also a very important component, So then community is critical. I think that's another, say everything is what makes Kairos unique, but it is. We emphasize community, togetherness, brotherhood. We do that through house meetings. I myself coordinate different fun events, like we have Spades Night that occurs on a bi-monthly basis. And some of the gentlemen enjoy participating in that and having that healthy competition. We have cookouts and things just to build that sense of togetherness and support that one would need if they're trying to overcome a substance abuse disorder. And then recovery, obviously, right? That's something that's so important to focus on. That's why most of the gentlemen are there. So we have AA and NA meetings that they participate in weekly. They have one-on-one sessions with our certified addictions counselor on staff. And they also participate in a New Day recovery class, each Kairos member at least twice. So they are busy men and just well-connected and supported. So I was giving some thought to the structure of the program and why it's successful. And I'm going to tell you more details to prove that it's successful. But I stumbled on the 4 pillars of recovery, according to SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And so they talked about the 4 key components that someone should have in their life to enable them to have a successful recovery from substance abuse. So like think of a table for, the 4 legs that you need. And for your table to be stable, you need all 4 legs, right? So this kind of blew me away. The four pillars that they note are health. So being able to manage your health conditions, home, having a stable, safe place to live. Kairos is that. Having purpose, so having meaningful tasks that you do, hobbies, volunteerism, but having some type of sense of purpose. And then community, so having relationships and social networks that provide support, friendship, love, and hope. So I don't know if you were paying attention, but that sounds a lot like the 5 components that I was mentioning earlier, which to me, it makes complete sense as to why, our program members tend to be very successful when they are overcoming their substance use disorders. So I'm running over time a little bit, but let me just tell you about the success rates before I give it back over to Kira for questions. So we've had about 215-ish program members since the inception of the program. And we've been able to keep track as best we can of people who've maintained their sobriety even after leaving the program. And right now our sobriety rate over the course of the program is 76%. So that means 76% of current and former Kairos members have maintained their sobriety from drugs and alcohol to date, which is amazing. But I want to, give some added context. So the reality of the situation is that when someone is overcoming a substance use disorder, sometimes relapse is a part of the story. Okay, we can be real about that. And so I was looking for some figures about what's typical when someone's dealing with this disorder. What's typical for the likelihood of them, having a relapse? And what I found, and this came directly from the National Institute of Drug Abuse, roughly 40 to 60% of those who are dealing with substance abuse disorder have some type of relapse during their recovery. And that's across program types, okay? So AA, therapy, other treatment programs across the board, 40 to 60% of those individuals will, suffer a relapse, unfortunately. So our relapse rates for the Kairos program, for active members, we hover at about 5%. So I think that that's pretty concrete evidence. I can give you other examples, more anecdotal examples, but I think that's pretty concrete evidence that the structure of the program is pretty effective for 5% of our population currently to be dealing with relapse, unfortunately, versus the 40 to 60%, which is the national average with other treatment types. So want to leave it there for now. I know I'll have an opportunity to talk about other details with the questions, but just to be mindful of time, Kira, I'm going to hand it back over to you.
Great. Thank you so much, Kelly, for sharing all of that. Like you said, there's so much to talk about when you talk about Kairos, and I think you did a great job of not just summing up our program, but putting it into context. And, we have a great understanding of your own background and all the steps that led you to be in your role now, which is really great to learn about. So I'm just going to get started with some of the questions. You touched on this a little bit, so, you don't have to go too in depth, but one of the first ones was, what brings you, what called you to supporting the Kairos program and working in the role you're in now. And, like you said, not having come up with the same background as a lot of the folks in the Kairos program, what was at the heart of that, tugging that you felt, I guess, like you said?
Yeah, that's a great question. I've been searching for that since I, came into the social work field. The best that I can come up with is just the example that Jesus gives. Just my desire to emulate his servitude towards people who are discounted and forgotten about and neglected, just wanting to be like him, truthfully. And there was some point in my life, I feel like I'm about to get emotional, so bear with me. There was some point in my life where I had a realization that there's nothing separating me from the circumstances that, the Kairos men or any other person who's dealing with homelessness. There's nothing that's different about us. It's just circumstantial, I think about the phrase, "There, but for the grace of God, go I." So it's only because of fate, the stars, I don't know, that I've been handed this particular life. And I feel like this is my way of kind of like writing things and balancing the scales. So yeah.
Thank you.
Oh boy. Yeah.
That's a beautiful answer. I'll pivot more to Kairos programming questions.
Thank you very much.
Yes. So what is next? How does Kairos House encourage residents to move into permanent housing? What criteria does it use to determine if someone should become a long-term resident? You touched on this a little bit. And then how much turnover does Kairos House experience year to year? So maybe touching on if there's ever circumstances where someone might move out of Kairos into another permanent housing option that's maybe a better fit for them too.
Yes. So Kairos, I don't know if I said this phrase, but Kairos is actually permanent supportive housing. So the men can stay there as long as they want, provided that the building is still erect and the program is still running. So there's no time limit. It's really up to the individual. Now, in cases where maybe their health needs require a higher level of care, then that'd be a different story. But generally speaking, program members on average stay about 9 years. That's what I've found in my research. And when men do leave, it's for reasons of, unfortunately, relapse in a small number of cases, but also maybe they want to go back to work. Maybe they feel like I've gotten all that I need from the Kairos program and I'm ready to spring forward. Sometimes people have gotten married and they want to, start their life with their significant other. There have been a number of reasons, and I used to have, I'll be honest, some trepidation about folks leaving the program. So I was like, oh no, why are you leaving us? But then I had to really look at the numbers and like where the men were going. And generally speaking, they're going to other stable housing opportunities. And so I'm like, okay, I need to look at this differently. This should be something that we're celebrating, that someone got what they needed from us and they're moving forward. And now we have room to welcome someone else who's in need. So the turnover rate, I think this year we've had four departures from the program. One was someone who passed away, unfortunately. One was a relapse, and 2 people went on to do bigger and better things. And I think, yeah, that's generally how it goes year to year.
Great, thank you. That's helpful in putting some context and some good examples there. So our next question, what are the biggest challenges residents face when they're transitioning. So I guess from Christ House, the respite floor, over across the street to Kairos. And then building off of that question, what are Kairos House's biggest needs maybe in other challenges in serving residents?
Mm-hmm. Okay. So I think that the biggest challenges that the men face when they're coming from Christ House to Kairos House is Christ House is respite, right? So you're resting, you're getting taken care of really well, you're getting time to recuperate. So it's more of a passive kind of experience, if you will. And over at Kairos, there's more to do. It's a lot more active. There's a lot more freedom because at Christ House, we ask them to stay within certain parameters or a certain area. And once they get to Kairos House, we're like, okay, bye. You can have some freedom. So I think that's a little bit of a difficult switch for people at times. And also the fact that they have to be more active as far as their participation. And when you are trying to change things about yourself, sometimes that requires folks to have difficult conversations with you. And sometimes you have to confront parts about yourself that you weren't ready to confront or you wanted to conceal. And so I think there's a lot of a molding that occurs at Kairos House that does happen at Christ House, but in a different way. So I think that's probably a big challenge. And then as far as the second question was, what was the other question? Yeah,
I can get there. So what are the greatest areas of need Kairos House experiences, and as well as the greatest challenges in serving residents?
Mm-hmm. We have a very small staff. No surprise for the nonprofit world. 4 full-time folks, and then we're fortunate to have some part-time people come out and help us as well. But as our population ages, their needs become more complex, and that requires us, more from us. And so that can be challenging at times. And I think we're able to overcome that because we're directly connected with Christ House, obviously. And so let's say someone needs greater medical care, then perhaps that would justify an admission to Christ House for a period of time where the 24-hour nursing care can be utilized. And, I'm also able to draw on resources from the case management office or, other folks at Christ House if there's a time where we're really feeling particularly stressed. So that's the best way that we overcome that challenge.
Mm-hmm. That makes a lot of sense. Like you said, similar with other nonprofits. And then zooming out a little bit for the next several questions, is the Kairos recovery model replicated throughout the country anywhere? And yeah, we'll leave it at that for now.
Okay. No. I mean, I personally have not seen a permanent supportive housing program with as much support that we offer our men. Yes, there are other permanent supportive housing programs, but I've not seen one with quite as robust of a menu of services. I do want to say really quick though about permanent supportive housing programs. They have been found to be like one of the single most effective ways to reduce chronic homelessness. And just to define that for folks who may not know, chronic homelessness is when you're homeless for a period of, a consecutive year, or if you've had like multiple incidences of homelessness, I think spanning over 2 years, and you also have an illness. And so that's the population we serve. And so permanent supportive housing is like the best way, time and time again, research shows that that's the best way to end homelessness for those individuals. So yeah.
Got it.
So, yes.
Go ahead.
So what I was trying to say with that is that model is consequently being replicated around the country, the permanent supportive housing program. And you'll actually notice a trend if you look at, the numbers of homeless beds in the country, that money is being shifted across the country from emergency shelters to more permanent housing opportunities, such as permanent supportive housing.
Gotcha.
Mhm.
Yep. We get asked often what the biggest, what leads to homelessness most often, and it's usually just lack of affordable housing. So what the solution is more housing in that case.
Exactly. Yeah. Mm-hmm.
Our next question is from one of our participants who asks, what ways can clergy partner in advocacy and equip their congregation to dignifying support for those experiencing homelessness?
Yeah, there are several organizations across DC, and right now I'm like a deer in headlights and can't remember any, but I'll make sure I send them to you, that people can partner with to kind of, share their voice about these different issues. But, on a smaller scale, you're welcome to have some of your congregants come to Christ House and help us provide that dignifying support for our homeless brothers. And, if that's not the option that you choose, there are also things like, creating hygiene bags for people who are experiencing homelessness, or, creating some type of program within your own church to do your small part to, show the homeless community that they are loved and they're not forgotten about.
Yep, thank you. Yeah, and I'll be dropping a link for volunteer opportunities here at the end of the chat, as well as my email. So if anyone is interested in that, I can certainly send that over. Next question, are there any plans to expand the Kairos program?
I'm not aware of any plans at the moment. Right now, unfortunately, because of the pandemic, we've noticed kind of a decrease in admissions at Kairos House. So I think instead of expansion right now, we're focused on trying to find the right people for the beds that we have empty so that we can, serve as many people as possible and use the resources that we've been given, use them well. So I think we have to get there first before we talk about expansion. But who knows, maybe that would be, a couple of years down the line.
Great, thank you. And then I don't see any questions in the chat right now, so this is your last chance, folks, to add some. But the last pre-planned question that we have, do you see the direction of future healthcare for the homeless programs moving towards programs similar to Kairos House?
Yes, and just kind of piggybacking off of what I was saying earlier, that just overall as a country, I think we're starting to get it. Years ago, the message was always, let's make sure we have enough services to help the homeless. We need to help the homeless. And now the messaging has shifted to, we need to end homelessness. Like, we can actually do this by providing adequate housing. And so I did have a statistic that dear Abby, one of our staff members here at Christ House, helped me compile, but it just kind of shows the increase in permanent supportive housing. So in 2009, in DC, there were 1,740 permanent supportive housing beds for chronically homeless people. In 2021, that's the most recent data that we could access, there were 10,000 beds. And so that's like a 491% increase for those years, just to show like how much more effort is being put into providing permanent supportive housing. So to answer the question, absolutely, I see the direction of a lot of states shifting more towards permanent supportive housing and programs that they try to be like Kairos.
Wow, that's great. That's a great statistic to end on as well, seeing some positive positive changes in policies. Great. Well, that is all the questions I have and that I see. If anyone has a question that you think of after the fact, you can feel free to send it to me. I'm going to drop several links in the chat now. And I just want to thank everyone for coming and for taking this opportunity to learn more. And I also want to thank you so much, Kelly, for sharing everything. It's been really helpful getting to learn about, like I said, your own journey here and everything you've been doing and everything that Kairos has to offer. So thank you.
Yes, my pleasure. Happy to share.